So we've been in conversation with you all for a while now about this issue of time and how certain cases take more time than other cases. And you all told us the things that you've noticed that increase the time required to get through that application. So this was the original list that we talked about as a group. People don't have an ID. We can't find the right language interpreter to do this. We need to find more documentation for their immigration status. So you gave us these things that you've noticed in your own work that really increase the amount of time and effort required to complete an application. So this whole effort is to try to document when these things are present in a case and how much time, how much they drive time. So what we've done, as we've continued to have these conversations, is really dial in the things that we're going to be looking at for you to collect from your encounters. So we've set up a little database that will be available to you to do this data collection that we're asking for. And really the purpose of today is to just orient you to what it will look like and what we're asking for. And then we do need to move forward. So if you're at all interested, or I shouldn't say if you're at all interested, at this stage of the game, we need kind of more firm commitments. So if you want to play, you want to be a part of this, we have some steps that I'll cover at the end for getting you set up. So what we're asking sites to do for a period of time, which is really December 15th through March 15th. Oh, Abigail is just saying she's here for clues. Excellent. I don't know if anyone else was coming from your team. So this is going to be for a time limited period. We're not going to do this forever. So we're aiming to start December 15th and go to March 15th. So it's just for those months. Today we're doing the orientation. There will be a stipend provided to your agency of $2,000 for your participation. And then we will work with you to set up a database that is just for your site. So we're not, so your information will be viewed by your team and by our team. There will be nobody else in your database. So let's move into, before I go there, let me just share my screen and show you what the actual system looks like. So it's called Capsule, but it's a web-based system. We're going to send you this link. And we're going to set you up in here we're going to set one up for clues, and we're going to set one up for North Point and for NAC. That's how we've set this up. We'll get you in here, and then you can come in here and enter your data. If you prefer paper, we can also do it that way. I know some folks have said we really need paper, a paper version. So once you come into the system, this is going to be the first thing that you see coming in. And we're going to walk you through, pick up here and talk you through the things that you would need to do next. So you open the system, you come here, and this is documented. You don't have to remember this, but you're going to click on person. And this is basically what the data entry panel will look like. So you'll be asked to enter the client's first name, last name, your organization, and then their date of birth. So we're not collecting social security numbers. We don't want that level of identified data in here, just first name, last name, and date of birth. And then we're asking you to collect some information about that conversation. So we're asking for you to document every encounter. So we're asking that you, every time a client comes to you, that you generate one of these things about that particular encounter. So we're not, hopefully that's clear. This is for each visit that you're having with folks. So let me jump back to the slide. So you're going to come into the system like I showed you, and you're going to go to add a person. We're using this system. It wasn't designed for how we're using it, so it's going to be a little weird, but we think it'll work. So you're going to come in here and click person. That's how you open a fresh record for putting information in. You're going to select client from the dropdown. You're just going to enter a name as you normally would, first name, last name, your organization's name, and there's this field, the job title, we're not using that, just ignore it. you're going to click on client first name, last name, and your organization's name. And this will be saved, so you don't have to do it multiple times. Just the first person in there, you'll have to write clues, and then your database will have it. You don't have to keep entering it. But what you will enter every single time is client first name, last name, even if we expect you'll see some people more than one time. So you just enter them again. I saw Lucy again today, Lucy Hernandez, the client, clues. I'm going to ignore this. So every single time we need you to enter the same information in, if it's the same person that you're working with. Once you're into the system, we have used this section called custom fields, which I'll go back into the system and show you, but that's where all of our study stuff sits. But when you go in there, you won't see it expanded. So you just need to expand this section using that arrow. So from there, we're going to just go field by field and enter the information. So we need the client's date of birth. You'll put that in there. You'll be entering information about that specific visit. So what's the date today? You know, I'm talking to you, Lucy. What's the date today? How many times have I already seen you, Lucy? Oh, this is your third time. So the encounter number is about how many times you've worked with this specific person. So if it's three, if it's one and you're done, it's just going to be one. You enter the encounter number. And then we want you to tell us how you're talking to me, or how am I talking to Lucy today? I'm talking to her on the phone. So phone, email, in person, these are the options for how did this encounter happen. So some information about the encounter, some information about the application that you're working on. So are they seeking assistance with a MNsure application? We know some people don't. So we have no in here. Some people are not talking to you because of that. Or it turns out that they don't want to put in an application, but they've come to you for some other reason. So you can just say no. But most people will be putting in an application. So tell us what kind of coverage they're seeking. So we've put in all the options that we're aware of and a couple options that are specific to certain sites, just so it's a complete list. So if you don't know what it is, you can ignore it, but hopefully we've captured all the options you would be working with in terms of type of coverage. I have it in there twice. We ask you about a little bit about the applicant, their demographics. Are they citizens? And again, all of this is tied to, it's either tied to demographics or it's tied to those factors that we got from this group. So are they a citizen? How many children are in this household? How many adults are in this household? So just enter those numbers in. Abigail says if it's EMA, do we put it under the MA option? I'm not sure what that means, but we can add EMA as another option on that drop down. Would that be responsive to that, Abigail?
Yeah, that would be great. Oh, or Jennifer says maybe yes.
Okay.
Okay, that works. Okay, cool.
To keep it, so don't add the EMA is what you're saying, Jennifer?
I feel like it's a type of MA in a way.
Okay.
But we could be convinced otherwise if you think it should be separate.
What would be easier for you, Abigail? Does that hold for you to just put it under MA?
Yeah, that works to put under MA because it's not like, I think that would be more relevant to see like how many people are using which program, which is not really the purpose. So yeah.
Got it. Okay. Yeah, keep asking questions in the chat as I go along. The point is also to show you what the options are to see if something is missing.
Sorry, while we were on that topic, I'm not sure if everybody used advanced premium tax credit and tries to help people with those, but that's on the list if you do. But we weren't sure if everybody uses that category. We know NAC does.
Mm-hmm.
I know we know you all do, but so that's on the list, but I don't know if others do.
Mm-hmm.
So if
Abigail,
will it be like formatted for each individual organization, or is that a set thing in there?
This would be set for everybody.
Okay.
Yeah. So if there's something else that should be on this list that you do, we should add it, and it would be added for everybody.
Mm-hmm. Good questions. So then moving through demographics, these are the options that we've included. So I'm just going to pause, let you look at this list, tell us if something should be added, modified. It looks good. Okay. And then we have language options listed here as well. Give you a minute to look at the list to make sure your language is represented here. The languages you work with are listed here.
Oh, I don't see Somali. Is there like a scroll down or are those all the
Oh,
languages?
you're right.
Yeah.
Oops, hold on.
I think it was on the, it was on the list. Maybe the whole thing isn't
Maybe
showing.
just scroll down, maybe. Yeah.
I can't scroll in it, but let's
Oh,
go.
that's all the list.
You can go
uh,
over to the entry.
Let's go to the actual database. Let's see, so language.
For some
No,
reason, I think it was closer to the top, but maybe I'm
no,
mistaken.
it's alphabetized now. So I
Okay.
think that got lost in the shuffling, which is a major language group for us here. So we'll add that. Good catch.
What about French?
I think French.
Mhm.
Yep, right here.
Okay.
Good, thank you. Tender options, tell us if this is complete, what should we add, what should we modify? Okay, income options, under 5,000, between 6 and 10, more than 11. Does this fit? Should it be more granular for income? I'm looking at the chat too, so if you're not putting it in the chat and you're quiet, I'm just going to take that as it's fine. Okay, and then household size, you just put in the number, tell us how many people are in that household. Okay, so now we're moving into the time factor. So this is really the heart of the study is, are these things present in the case that you're working on? Are these factors, are you dealing with these factors in this particular application, in this encounter? So these are just checkboxes. You're just going to click it and check it if that is something that's come up. So I'm just going to go through these kind of quickly. Hopefully they're straightforward. If the person has no physical address, that's a factor you've named. No ID, no form of identification that's been named. Applicant cannot read or write in their native language or otherwise, that was something that was named. Availability of family members to complete the application. So I need your wife here to do something and she's not here now, we can't move forward, that kind of thing. Availability of family members. No language support, so we can't find the language interpreter that we need to move this forward. So we just be check, 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 check if those things are present. Immigration status, anything related to immigration status. I need this extra application. I need to find this piece of paper, that kind of thing. That's a result of immigration status that has been named as a factor. Life event, I think you all are familiar with what we mean there. No credit history. And then health plan consultation has been named as a factor. Impact on other family members has been named as a factor. So here it means, I think the example that someone mentioned was like someone wasn't in the country and we were trying to do an application and they weren't here and we couldn't move forward because that person wasn't physically here. So that's what we're calling impact on other family members. Does that make sense? And we're looking for, we've tried to make these as specific as possible, but if you're not sure, you can always email us, or you can put a note in here for us. I'll show you where to do that, but we're trying to cast a wide net and capture anything that might be driving time. So this one, if it's not clear, we can rework it, or you can tell us once you're in the system. Use of computers or a website. We've heard a lot about how that adds for more time. The applicant doesn't have a phone, has been named. Some people are giving people phones, securing a track phone. If that's what you're doing, that should be noted in here. MNsure errors. A lot of people have mentioned that they spend a lot of time on MNsure errors, so that's in here. Name confusion. That's another thing that's come up. Same first name, same last name, but you're not the person. That's been named as a factor. Verifying income, we've heard a lot about just how much time goes into verifying income. Inaccurate MNsure decision, so untying that or trying to correct that. Many of you have talked about hours you spend doing that. That's in here. Trying to reach MNsure, trying to reach the county. These are both things that were named as things that take enormous amounts of time. And then there was a mention of a special population application. I'm not as familiar with this, but I understand that you all know what this means, that it's a paper application under certain circumstances that's about 15 pages long. If you're working on that, we want you to mark that in here as well. And that's it. So those are all the factors. So I'm going to pause. What isn't clear to you on any of these, like how we've named these, or for like?
I just wanted to add to that we do have a section where there is other. We do have a place for there's other and where you can make notes. So if you're going along and you're like, doesn't seem to fit, you can also put it in the other.
Yep. Because you may have others that you identify that have not been captured here. Yeah. Do these feel clear? Is it clear enough that someone in your team can go in and be like, okay, I know what you're asking me. I'm going to click that. I know when to click this and not to click it. Okay, so I can't believe it's that crystal clear, but great. If it is, you're not saying anything, so I'm going to assume it's clear. So once you've put in all the factors, you've checked all the boxes, we want you to tell us how much time you've spent. So we're asking for it as a a single digit. So if it's an hour and a half, put in 1.5 hours. So that's another kind of cornerstone of this, is how much time did you spend on this encounter that had all of these factors present. And then we do have, like Jennifer was saying, an others field, so you can add other factors that came up that were not on the list. You can also give us notes about something about the case that you want noted that you feel is really important. These are text boxes, so you can enter in here. And then we were just also interested in hearing if you're making referrals out for this encounter. So I'm getting housing lined up, or I'm over here doing an employment thing for this person. You don't have to write a ton, but just tell us if you're doing referrals to other things. That would be great as well. So maybe let me just jump over to the system so you can kind of see what it looks like. So let me just kind of back out. So you will have come in here. This would be the first thing you see coming in. We're adding people, so not an organization, opportunity, or case. We're adding a person and we're tagging them as a client and we're putting their information in, and then we're clicking here. This is where all this stuff lives. So the client's date of birth, the date of the encounter, How many times have I seen you, Lucy? Oh, 3 times. I'm gonna put 3 in here. Today I'm emailing you, so I'm just gonna put email, and then so on and so forth. So here at the factors, they're just checks. Yeah, Lucy doesn't have an address. We're trying to get her birth certificate. I don't know, I'm just making stuff up. I'm trying to get her birth certificate to do this. She needs a phone. I'm working on getting her a track phone. And this took 2 hours today of my time. This stuff at the bottom, you can ignore. We don't need your contact details. This is really the last thing you'll enter is the total time that you spent. And that's it. So that's what you would do for every single encounter. And then when
And then
we
push
will-
save. You would push save.
Yep, push save. I'm not gonna save this, but yes, you'd push save.
Now, what some of you have asked is if we have to put in the demographics every time.
Mhm.
And so one thing I know too, you and I talked about is if you go back into this system, or I'm sorry, we didn't give a name to this person just now, so I don't know if you want to say Lucy again from before. But if this is your first encounter with Lucy, by all means, we need the demographics, the language, the race or ethnicity, that sort of thing. But if this is like your second time or your third time with Lucy, you don't have to re-enter some of the stuff at the top. Unless it's changed. Let's say, oh, we thought we could do a Minnesota care, but now we're going to do MA. So, but there are some things that you wouldn't have to re-enter again if you knew that Lucy was already had a first encounter and that all this stuff was already selected.
Mhm.
So that's, you're allowed to skip that, but you have to verify that this is, if you go back to the list in the beginning, is Lucy in here already? Oh, she is, great. Then I don't have to redo any demographics. So.
Mhm. So if I had saved it, you would see Lucy listed here. Like you see client 1, client 2 at Navigator org 1, you would see, so you might see several rows in here for Lucy. You'll be able to see that you have 5 entries for her. So entry 1 needs to have the demographics, but 2 through 5 do not. Does that make sense? Does it feel straightforward? Kelly's like, Abigail's thumbs up.
I do have a few questions if that's okay to ask now.
Yeah.
Okay, so I wrote down a few things really just related to like how it would actually look, in the daily workflow. So we work with a lot of people who are asking for other things outside of doing the MNsure application. So would we do every single encounter, even if it was just like, I need a track phone or I need help with housing, if we did not do an application with them, or is it just that stuff in addition to the applications?
Jennifer, you want to go?
We are trying to collect information about what I think in the slide deck where it's additional assistance. So if somebody comes in and they need an application, that would be a yes under application. Or if someone comes in with, if you're getting them a track phone so you can help them procure insurance of some sort or health coverage of some sort, we would like to have the addition, because part of the case is that you're doing a lot more than filling out an application. So how much time is that additional assistance taking? Now, if they come into your clinic because and it's not really related to insurance and you're just helping them with regular case management or something like that, and there's really not insurance involved in any way, then that might be just your regular work, I guess.
Okay, yeah, that's good to know. Okay. And so then this, like you're talking about the encounters as in like face-to-face and also over the phone. But if we're just checking, like, I don't know, if we're on the phone with ARC or with the county or something and have not corresponded with the person that day, would we not put that?
If it's on behalf of a person that you have been helping them with their MA or some other county related coverage, that would be for that person. So that would be like, you know, I'm contacting the county. I think one of the time factors is about the county. It was once upon a time there was a county factor, and so you'd be like, it's on the phone because you're talking to the county person over the phone, but it's for Lucy, and it took 45 minutes or what have you.
Okay.
And you would click that
Okay.
county contact button.
Okay, got it. I have one more question, just kind of, can you clarify a little bit about what the encounters numbers would be? Just, like if so say I have like 3 separate correspondences with one person over the course of the day, like as far as like making it the most beneficial for the study, would it be better to actually put 3 separate ones in there, and which might be kind of hard as far as time, or just put them in at the end of the day and put like 3 as the encounter number?
I think go ahead. You can go ahead.
Well, I was just gonna say, if they're like apart in the flow of your day, I would say do them separately, so you're not trying to hold on to stuff throughout the day. If you're able to if you're able to come up with the total amount of time across all 3, then you can just put it in as one and just capture all the factors and all the time. If that's
Okay.
what workflow is like, but because I let go of things quickly, I would have to just do them separately.
Okay, sounds good.
What we've heard from some sites is that they're going to have a study coordinator and potentially even use a paper printout of this. And so if you had the piece of paper from earlier in the day, you could be adding to it. Okay, and the second time I'm doing this, I'm doing that. And then they're having a study coordinator enter their data for them. So then you would pass that paper on to your study coordinator to do the data entry. Or if you're doing the data entry yourself, you could do it whenever your workflow. It doesn't have to be every day. It could be at the end of the week, you have a little stack you're going to enter, or every 2 days or something. So it's a little bit up to you. We do want to know on average, how many encounters did it take and how much time did it take to help people. And these are the factors that are driving those number of encounters and that amount of time. But we can be flexible about that too, if it's happening within the same day.
I mean, you could like, if you have the printed copy, like Jennifer's saying, in the encounter number, do hash marks, like you could just track it that way. So then you're able to say this involved 5 encounters, but and this is the total amount of time. What other questions do folks have?
I have a question. Has anyone tried this, or it hasn't rolled out? Have you guys done a time study on how long it takes to complete the forms?
This is the pilot, so.
I thought maybe you guys kind of did a mock to see how long it would take.
Oh, it took me 2 minutes to enter in data about a fake client,
Yeah,
so.
We put in like our own just testing stuff, and it's 2-3 minutes, maybe 4, maybe. Yeah. So
we set it up that we can do weekly, put that information in weekly instead of daily. I think I talked to.
Yes.
And you wanted the paper, right?
Yes, paper. So then a staff would be assigned to do it for the week each time. So then it's just easier for them to take all the paperwork and do a data entry.
If the data system is too unwieldy for your site, we do have it such that you could scan us your papers and we could have somebody on our end do the data entry. But it might be easier to do it. And in any case, if there is something that is a significant barrier to data entry, we would then collect your papers.
Yeah.
So, or
That's
a snail mail.
Yeah, nice to know. Thank you.
Sure.
Yeah, you can scan them and email them, or put them in Dropbox or something for us. What other questions? Let's see if I can get to my slides. So there were a couple of I think there was one more issue that we wanted to go through, which is about security. So again, we only want client first name and last name and date of birth. This system is not HIPAA compliant, but it's encrypted. So all the data that sits in there is encrypted, and feels appropriate for the level of information we're working with here. So if that's a concern, that's the capacity of this system, is that it's not HIPAA compliant, but encrypted. And don't put social security numbers in.
I have a question. If
Yeah.
someone doesn't want to provide their name, can we use like a pseudonym? And like,
Absolutely.
do we need to provide date of birth, or
It's
like
mostly-
and also what's the reason for date of birth?
We're trying to, so if, let's say we're, Lucy, and we want to know how many encounters Lucy has, we have to be a way to track every encounter for Lucy. So first, last name, date of birth is how we hear some of you track in your own systems, people. So we were trying to come up with a way so that you knew Lucy was like, because you can, is Lucy in the system? She is, okay. We want to be able to, we have to be able to match the data across encounters. So
Okay.
we were thinking about a case ID system, but that seems like it's even harder. Like, who the people are. The date of birth is just to make sure, what if there are, 3 Juan Lopez's that you're, working with, which one? So it was the date of birth, was to try to keep it a little bit more unique, so that it is possible people will have the same birth dates. And then in that case, we might need to come to you and work with you a little bit about whose encounters are these. But we just need to be able to make sure that if Lucy has 5 encounters, we can see which ones they are. And we thought this might be a way, but we're open to other ways if things fall apart.
And it's also, I don't know if you said this, but it's also for you to keep, like, if you have a very common name in there, like, Bob Jones, and you have several Bob Joneses in your sphere, like, it's also being able to pull apart who's who, which typically the date of birth will help with. So as long as you're able to keep things in sets for each unique person, you could use this fake name, you can, so that's the purpose of those 3: first name, last name, date of birth. Does that make sense?
And it's almost like for
Yeah.
data auditing, maybe if you go back to that one people pick place to Hoot on the, like, when you look at the sure, when you look at the list and you're like, okay, there should be 5 entries here for, so-and-so. If you don't see them, then there's something wrong, right? There's like, I wonder what happened to that other, or maybe it didn't get in here, or, so you're going to also be having the ability to sort of audit your data. We're going to come in here and do a little bit of auditing as well. And if we're like noticing something funky, we might contact you and say, this says entry 5, but we only see 4. Is there something else that we should see, or did we miss something? So this is a way for you to keep track, for us to keep track. It could be all fake names if you wanted. We don't need people's names or date of birth. It's just a way to keep track.
Right. You could create your own ID system,
Yes.
which we've done in some projects, and people love that, but then they can't keep track. So just a word of caution there. If that's what it's fine if you do that, but then you have to be able to keep track of which one goes with which person and all of that. Yeah, good question. What else? So if this is something that you want to and can do, the way to kind of sign up is to send us an invoice for your agency stipend, which is $2,000. And then we need emails for, if you're doing the system, what are the emails of the folks that need to be in here? We're going to set up a portal for your organization, so you'll be on your own. We'll send emails to the emails you send us to get you in there. And then we're obviously available to you at any point. If you're stuck, if you're like, I don't remember what this one thing was, you can reach out and we can help you. We'll also be in your portal, just like Jennifer said, to watch and support. And that's how you get started.